At 6'5", he's known as a gentle giant to most, competing in one of the roughest, most physically demanding sports in the world, mixed martial arts fighting.
Just trying to impose my will and get the victory.
You can find 29-year-old Kennedy Nzechukwu in this Dallas gym almost every day.
Yeah, I train 6 days a week.
Until one day,
I guess during wrestling it snapped.
He felt his ACL tear.
A lot was going through my mind as far as my career. I was like, damn, I'm done. I won't be able to fight again.
His team doctor referred him to Dr. Jay Shah, an orthopedic surgeon at UT Southwestern Medical Center.
ACL stands for anterior cruciate ligament. It's a ligament that goes from the thigh bone, the femur, to the shin bone, the tibia. Being a professional athlete and knowing that a fast and speedy recovery is extremely paramount to getting back to what he likes to do and what he wants to do and does for a living is extremely important.
It's important because his hunger to win brought him and his family to the States from Nigeria over a decade ago. With the encouragement from his mother, Kennedy picked up MMA fighting in 2015 and went pro just a few years later.
Because my mom always talked about pursuing your dreams so you won't regret it when you're older.
His passion is fighting, but it's also serving. Kennedy's mom was diagnosed with Lou Gehrig's disease, or ALS, 7 years ago.
I couldn't continue with college because I had to take care of her. It was hard trying to balance everything.
Between being a full-time caregiver and sole provider, Kennedy was training 35+ hours a week at the gym, fighting for his family, which was why the injury in the fall of 2019 was so detrimental. It was critical that Kennedy found a provider to get him back in the octagon as soon as possible.
We decided together that the best decision for him would be to take a patellar tendon graft from his own knee.
My journey with Dr. Shaw and UT Southwestern has been amazing. They have a great staff, great physical therapists, a great surgeon, which is Dr. Shaw, and it's been awesome.
This is called the Lachman test.
After months of intense physical therapy at UT Southwestern, Kennedy was ready to get back into the ring. However, with the COVID-19 pandemic, UFC had to cancel all fights in 2020, so his comeback was delayed. But in March of 2021, he came back with a vengeance, knocking out his opponent in the second round.
That first fight, I was nervous, but the knee held up perfectly, and I'm grateful for that.
And his fight in June looked very similar, taking another victory to the bank.
Yeah, I'm back to where I was before. I'm back. I'm surpassing that level.
And neither one of them did it move, right?
Continuing to give credit to Dr. Shaw and his team at UT Southwestern.
With the help I've gotten from UT Southwestern, that's awesome. It's been tremendous. It's played a vital role as far as the rehab that I got from them, because I got some crazy, amazing state-of-the-art rehab.
UT Southwestern is a top-notch research institution, orthopedic surgery department. We're looking at our outcomes. We're trying to gather data on whether our techniques are working well and what can we do to make them work even better, faster, and more efficiently.
Feels strong, I think it feels stronger than this one.
Though life has knocked him down, Kennedy Nzechukwu vows to always get back up.